Welcome, everyone, to TNT Live, the show where we will test out the bounds of what will be allowable on YouTube slash Facebook slash Twitter. Tonight, we're going to be doing some heterodox takes on COVID. Things that, we're not going to be out there saying, everyone, the vaccine's fake, blah, blah, blah. But, I've been watching enough propaganda, CBC, and the things aren't adding up. So we'll go over some pretty interesting takes. If you have your own takes on COVID, let us know, and we'll try and keep this one rather interactive. And the other thing is, I'm currently in Yellowknife, so different lighting is not great. It is 7 p.m. here, so if you do hear a screaming toddler, don't worry. It is call child services. He is being detained. He does maintain he's not tired, so call a lawyer. Call John Carpe at Justice Center for Constitutional Freedoms because he is being forced against his will to take a bath and go to sleep. So that's what you should do. Other than that, everything is normal. So welcome, everyone. Thank you, Matthew, for helping us with the algorithm.
I wanted to say before we begin, I do promise that I was supposed to get my hair cut today, and the appointment has been shifted to tomorrow. So in the future, I'll stop having an afro in these things.
We'll let the people decide what type of haircut you should get.
Yeah, and we'll just do a poll.
We'll do a poll. Yeah, I say Wyatt should get like a mohawk, Mr. T style.
Yeah, I should get like a taxi driver mohawk, except it'll be like still curly, so it'll just be really stupid. I'll get like a carrot top mohawk.
That'd be good. All right, so where do you want to start on this? Because you've been doing a lot of research and you've just gotten a lot of information on the AHS and the COVID. Should we start by sort of outlining like what the government plan seems to be, and then start to poke holes in it like one by one? Is that
AHS is a bit more complicated. AHS seems more like a bureaucratic issue, like the reporting that we've been doing at the National Telegraph on the AHS, showing that like they've promised back in 2020 of April that they could increase our ICU beds by more than 1,000. They never did it. The government even gave them the exact amount of funding they would need for 1,081 beds. Never did it. That seems more like the issues with bureaucracy being able to get away with as much inefficiency as it wants. No one's ever going to call out bureaucracy for being bad at its job. The media will let them go. But I think what you're getting at for the topic of today's episode is just the sort of that no one's saying it, but essentially what they're going for in Canada especially is this whole zero COVID method of trying to get through the pandemic or whatever. I don't even think we're technically in one anymore, but I mean, that's sort of why you wanted to do sort of this topic, is to talk about just the strange logistical nightmare that the government thinks can work.
Yeah, like we're setting up to fail. Like now, no one's openly pushing zero COVID. They were pushing that in New Zealand, and when New Zealand dropped zero COVID, then everyone else has to. For the people like using New Zealand as a reference, like look how New Zealand's numbers are better. They're a tiny island. They're a tiny, sparsely populated island. Of course, they're going to do better with the respiratory illness than the rest of the world. Like, look at Australia and New Zealand. Like, okay, be an island. If that's your plan, then be an island. I don't know. We should plant like 87 thermonuclear warheads at the American-U.S. border and just blow us, and plant some in Alaska too, and just blow us off into an island. And then, it'd be, try selling that to Justin Trudeau, no more refugees or immigrants for a while. Like, his head would explode. So, what the government seems to want to do is like, yeah, they seem to be setting themselves up for the forever pandemic, like where there is no out. And we can talk about, they're moving the goalposts. Like moving the goalposts is the number one top seller in Canada. Like I remember when my family was all excited, and like doctors in my family, very happy with Doug Ford in Ontario because he set a clear goal when the vaccine, like once we get to 70%, then things open up at 70%, 70%. It's very clear. They're giving us the numbers. Oh, then we hit 70%. Okay, now 90%. Why? Delta. And what are the odds? The odds are clearly 99.9% that if we hit 90% vaccination in Ontario, then all of a sudden the number will be 93%. And then
the language they're already using implies that they think that the number has to be 100 because they keep talking about the people who still haven't gotten it, even though they talk about it in a totalizing way. They like everyone who hasn't gotten the vaccination needs the vaccination. And this is also what you wanted to sort of discuss in terms of you wanted to discuss the idiocy of knowing that vaccines seem to only last about 6 months, yet we're going to try and we're going to try and push for everyone to be vaccinated to full effectiveness.
Yeah. Okay. Yeah. So here's this is kind of what I talk about, and this is what was driving me crazy today. It's like, okay, so the CBC and the government's finally on the train of the vaccines are not perfect. They have effectiveness waning after 6 months. So after 6 months, we're starting to see the immunities you get from these COVID vaccines start to wane, and then we're getting the breakthrough infections, and people are going back to normal. And we've known for a while that natural immunity gives you stronger, longer lasting immunity to COVID. Now, is everyone get natural immunity the greatest idea in the world? Like, no, because that means exposing yourself, getting actual COVID, and then risking, going to ICU. And like people have very severe COVID cases. Some of you here might have had COVID already, and like it was the sniffles. I went outside and ate an apple, and I was fine. Fair enough, because that's what it is to probably a lot. Like if Wyatt or I got it, that would be the most likely thing to happen. Is we sneeze for a day or two, and then get back out into it. So my problem here is you see things like I'm sure a lot of you saw on Twitter, like the Saskatchewan Health Department saying, health, obesity doesn't affect COVID, age doesn't affect COVID. The only thing that determines your COVID outcomes is vaccination or non-vaccination. And you're like, that is patently wrong. That is so objectively wrong. Like, I'm okay with them saying like the most important thing in determining COVID results is vaccine status. Fine. But you can't tell me that if I was 300 pounds versus like perfectly fit and in shape working out every day, that's effect. Like if I was a morbidly obese 65-year-old versus a in shape 25-year-old, like, and both of us get COVID, like, I would take that. And I would take 25 fit unvaccinated versus 65 obese fully vaccinated. Like that's, I just, okay. So this seems to be the thing, is like they're only on vaccines. So if vaccines are the only determining thing in COVID health factor, okay, fine. Let's take this logic the government's putting out there that everyone needs to be vaccinated and then this goes away, right? And then we have vaccine efficacy now waiting after 6 months. Well, if you just think of it reasonably, there is no way like that we could logistically get everyone vaccinated within the same 6-month window to give everyone immunities, right? And then if that's our way out, like, this is basically saying the vaccine is 100% effective and everyone needs to get in the 6-month window. Like, how do you get all 35 million Canadians vaccinated within that 6-month window? And then considering we're not an island, right? And then we're going to have to let Americans in, and people are going to come from America, and we want to take refugees in from somewhere because Justin Trudeau is in charge. Like, then they also have to get vaccinated within the same 6-month window. So this plan only works if all 7 billion people on the planet are vaccinated within the same 6-month window that COVID can be eradicated. And that's also predicated on the fact that we assume the vaccines are 100% effective, which no one's ever claimed they are. Like, we were happy with like 90% effective, right? And if it's 90% effective, you're still going to get breakthrough cases. So like this is the crazy thing, is like, it was a bit of a disingenuous thing to be like, oh, look, he was vaccinated, he still got COVID, therefore the vaccines never don't work. It's like, no, we've never claimed the vaccine was 100% effective. It's
no vaccine's ever been 100% effective.
No,
I always got annoyed. I always get annoyed when people go down rabbit holes where they're like, it's not a vaccine, it's a treatment, and then they keep pushing that on you. It's not, because it isn't 100% effective, that means it's somehow like it's an experimental gene therapy or something like that. And it's like, you're going down a rabbit hole that is just not an effective argument for moderate people who really aren't going to get onto the activist protest train with you. You should be just saying, hey, they're about 90% effective. We can't give everyone one of these within 6 months. We sort of have to learn to live with it. I think that's always the best way of actually getting people to acknowledge the fact that the government's approach is not working, and we need something that's more common sense that actually allows for a modern economy to function.
Yeah, okay, this is what we're getting at. It's like, okay, so how do we live with this reasonably? Because the current government plan of vaccine mandates and just assuming and booster shots and booster shots and booster shots isn't going to work, right? So eventually, we're going to have a tough conversation where we're going to need to take risks, and we're going to have to suffer some maybe health risks to mitigate the loss on the economy. So the obvious answer here is make vaccines voluntary. And I think this is a good thing. Like, I think you can make a very strong argument for the greatest thing for the health of the population is if 100% of the population is not vaccinated. Right now, this is total anathema. This is horrifying to anyone on CBC News. And Dr. Chan just got like some panic diarrhea hearing this. But if you think of it, right, this is a respiratory illness. It's going to be with us for a long time. Like COVID's here. It was created in a lab in a country called Western Taiwan, in Wuhan there, and they did gain of function research, whatever. So we have this. If we're gonna need to be dealing with this long term, and we want to sort of test the efficacy of vaccines, doesn't it make sense from a scientific point of view? If you're like a scientist, right? If you can just look at this objectively, and we have to sort of do this and take a scientific view. Well, isn't it better if we have a control group to the vaccines? Like, don't you want a control group? Like, you kind of want to study long term. Like, if you want to study the effects of vaccines, this or that, or how it's working in different populations, like, isn't it good long term if we have a unvaccinated population that is sort of like the control group here? Like,
Well,
don't you kind of want that?
and also just like thinking back, like think of the negligence on the part of politicians and bureaucrats saying that it's somehow nutty or like unscientific to be looking for alternative treatments other than a vaccine. Wouldn't you want something that if someone gets sick with COVID, they can just go buy a small pack of it at the store and they can use it, reduces their symptoms rather than them just lining up and hoping that they get the vaccine before they get sick? It's a stupid, and especially that hopefully they get the vaccine before their other one wears out. Like it seems more rational to move towards something where, well, here's just the COVID medicine that you can go buy at the pharmacy if you want it. Like if you're over the age of like 40, maybe you should like take a tablet of whatever reduces like swelling or something. Like just like the common cold, where like, oh, or like a headache. Like I have a headache, I'm gonna go take some Advil, or I have X, I'm gonna go take X. It's stupid. Like you need something that's like COVID treatment needs to be made more casual and less regimented.
Yeah, that's the thing. It's like we're gonna have to learn to sort of deal with it, like as just like an illness that comes around. And like, yeah, the majority of people who get it are fine. Like, I don't know I mean, it's nearly impossible to track because you know, most people who get it get an asymptomatic case of it, which is not that rare, don't get counted in the data. So this is like another problem you have with like tracking COVID, right? So because there was like, it's kind of like, and this is the dishonesty of the government. Too, is like, because there were a lot of asymptomatic cases that couldn't be tracked, they were sort of inflating the COVID numbers because like we have X amount of cases, and like people were making the case like we have a case demic, not a pandemic, and this is actually a legitimate case people were making because people getting asymptomatic cases wasn't a big deal. And the big justification for all these lockdowns, like the number one justification for the lockdown, was asymptomatic spread, right? That's what we were told at the beginning. This was the science that was tried and tested and true, and like I can't remember who I was talking. Yeah, okay, I was talking with the doctor. We were laughing with the concept of the fact that at the outset of the pandemic, within like the first 2 months, anyone who claimed, oh, the science on COVID, the settled science, the agreed upon science, was a fool. Was an absolute fool. Within 2-3 months of something new happening, there is no settled agreed upon science. There is none. It's impossible. But to go back, the agreed upon, if you detract from this, you lose your job and you get banned from YouTube science, was asymptomatic spread. And it makes sense, right? If you could spread asymptomatically, then everyone needs to be masked and then we lock down because we need to control it, because you might feel fine, but you go out and you're spreading it by just breathing. Well, now we know that asymptomatic spread wasn't a real thing. So the number one thing that the science of the lockdown was based on, asymptomatic spread, well, it turns out that wasn't the thing. Have we got rid of the lockdowns? Because they're number one? Nope, not a chance. And it hasn't affected our lockdown policy one iota, right? The fact that asymptomatic spread then got shown to actually not be a thing, and that was the number one reason for the lockdown. And listen, if COVID did spread effectively from asymptomatic people, that is a significant reason for a mask, for masking indoors and all this, but turns out it wasn't. So, like, this is the problem, is we actually might want a control group here. And then the other thing with the kids is, why are we rushing a vaccine to the kids? Why? And I know why. It's because some parents are so terrified. It's like a 50-50 thing. 50% of parents are absolutely terrified of COVID and they need to inject their kids tomorrow. And the other 50% are like, whoa, hold the brakes. And, I'm with that 50%. I think there's a big moral breakdown here of like the risk of COVID to kids under 12 is near near zero, effectively zero, right? And the risk of this vaccine is unknown. We don't know. Like, is myocarditis, is that a thing in kids? Are they too young to get it? Is more of it, is that like more like, adolescent to young adult type thing? Like, yeah, the right answer is we don't know. We don't know.
Well,
But we're
one of the extremely I was going to say one of the extremely frustrating things throughout the pandemic so far, and when I say pandemic, I'm not saying it's a huge danger. It's just the definition of pandemic is it's a disease that's everywhere, and that is correct. Like it's all around the globe. But the annoying thing is that from both sides of the argument, you get a lot of half truths. Is it true that COVID is dangerous to people who are older? Yes, that's generally true that most people who are above the age of 60, COVID can be actually quite dangerous to. But then that same group of people who are really pushing that COVID is dangerous, they'll then apply it to children who the government statistics show that you're probably more likely to die of like a shark attack if you're under the age of 12 than you are to die of COVID. It's statistically insignificant the amount of danger that children are under. But then you'll have
this is
some
why
people
I've
who
been
say,
saying
well,
for
you have a
years now.
99.7% chance of survival, ergo it doesn't affect 85-year-olds. It's like, okay, now settle down a little bit here. It's dangerous to some people and it isn't dangerous to other people. And if we pay the government enough, they should be able to put out press releases and or hold press conferences where they actually break down age demographics and risks.
Yeah, and that's the thing is like they're lying to you, and this is a problem. Like the government is lying to you. But listen, there is something in here which does warrant a sort of group response on COVID, but we've gone way overboard, and it's been predicated on lies. And when those lies have been debunked one by one and disproven, it even when the government comes and admits it, it doesn't change, the solution. They don't say, oh, I mean, again, the number one reason for lockdowns was asymptomatic spread. It's not a thing, right? So, I mean, what we should be doing now is saying, okay, the plan is, guys, if you are feeling sick, wear a mask, right? Like in Japan, like in the Asian countries. That's a pretty good cultural thing. The mask has now been polarized, but go back to your 2013 brain. And if you're feeling sick in Japan and you're going on public transit, you wear a mask to not affect everyone else. That's a nice thing to do. That's a pretty good cultural idiosyncrasy on the Asians there. Good for them. And adopting that into our culture would be helpful, right? If you are sick, wear a mask, especially if you're going out. If you're sick, it does, even if it's not COVID, right? Even if if you get the test and it's not COVID, but you're sick, wear a mask outside. You're less likely to infect everyone else. That's a nice thing to do. If you're sick, stay home. Like these are things. Wash your hands, right? But once it becomes everyone must wear a mask all the time, everywhere, well, then people start to go like, no, I'm working. I don't. If I'm working outside doing construction in the hot sun for 8 hours straight, I'm told I have to wear a mask outside, or I'm wearing a jacket. Like that's stupid. You're outside. It's so uncomfortable. Your face is going to get a rash. That's way overboard, right? Then it becomes right. Then people say, okay, the mask rules are stupid, and I hate them because they're ineffective. Because then anyone with half a brain can look up and say, okay, masks don't work there. So let's address the sort of the masks don't work type thing. Like, so
we don't doubt that Delta variant, like cloth masks are silly and you probably shouldn't be using them, especially taking them out of your pocket. There's people at the
yeah,
CDC who've been
like
fired
I
for just
use
pointing
one.
out
Just take
you
off
need an
mask from your pocket.
N95, I think N95 or M95. One of those
N95
two.
works.
Yeah, you need an N95 mask to even reduce 50% of buildup from from the Delta variant on the other side of the mask. Like it barely, and I think even cloth masks, it only stops like 10%, which is insignificant in terms of a disease.
Yeah, so I mean, like where masks don't work is in like long-term exposure. So if Wyatt and I are going to be in the same room working together, right? Like in an office, masks don't work. They're stupid. The same type of thing. Now, if Wyatt and I have a brief interaction, on a very short-term interaction, right? And I was sick and I was wearing a mask, then yeah, masks do work. Like it is basic science on a respiratory illness. Like you do spread by particles and particulates. Like if you cough, you're spreading it, right? And that's why you cover your hand. Like this is why we teach children: cover your mouth when you're coughing. Right?
You mean cover your mouth? You're being that person who coughs into their hands.
Okay, yeah, cover
I'm
your
gonna be
mouth.
a stickler about this.
Okay, cover your mouth when you're coughing. This is the mask thing, right? If you're sick, wear a mask. And in short-term interactions, it actually probably does help a bit. Now, long-term like things like, yes, it's porous, like it's not fully covering your face. There's things we can get out. So long-term, it's equally as it like, long-term exposure, it's the same thing as not wearing a mask. So, this is a thing where it's like if we just said, if you are sick, wear a mask and stay home and self-isolate. I think everyone would understand that. And then if we gave dirty looks to people coughing in public, right, unmasked, well, okay, if someone's like coughing on the carrots at the grocery store, like, no, like, stop that. You're a bad person, right? And if it was this, I think everyone would be reasonable. Like, if you're outside doing construction, you don't need a mask, right? Or you might need a construction mask to stop the fumes getting you, but
also just moving on to the economic portion of the issues with the COVID approach is I find it hilarious that we're all you have especially a lot of people on the left are complaining that, well, we need way more funding to our health services. We need more funding. Like, welcome to public health care, everyone. It sucks and we don't have a lot of beds around. Unless we give AHS more beds, in which they just don't use them anyways. But people are like arguing like we need more beds. Like, why is our healthcare system so underfunded? Conservatives are awful. Okay, well, one is public healthcare. Two, it's almost like having people stay at home and not work is not a very good idea when you're trying to fund or grow the medical system. Like, that's insane. Why are we're trying to do two things that are polar opposites of each other. You have to have a modern economy that's running full bore to have a very good public healthcare system. We have a very lackluster economy and we're inflating the currency and we're pretending as if these dollars are we can spend more money and it'll get us better healthcare. It's like, that's just not how it works.
Yeah, it's not reality. So let's talk the other thing. Like this is the AHS thing. It's like 2 weeks to flatten the curve. And I've talked about like the concept around flattening the curve was a decent idea because you flatten the curve in order to, like, the reason why 2 weeks to flatten the curve is flattening the curve doesn't reduce the amount of COVID cases in general. Like, it just stops them from happening all at once at the beginning when we don't have the capacity. The point of flattening the curve was we flattened for 2 weeks. Then we should bring in more ICU beds and respirators and increase our capacity. That was never done. The money was spent, but again, the bureaucracies and the hospitals and whoever never built those beds that we paid for. So it's not being underfunded, right? We did do the 2 weeks to flatten the curve, but now it's
Michelle made a good point. You also firing healthcare workers, then complaining that we don't have enough nurses is like great logic.
Yeah, that's the other thing. Here's a good one. Has any government said they will remove the vaccine passports? Yes and no.
The United Kingdom tried to bring them in. They realized it was stupid, and then they abandoned it.
So, in Canada, I know Doug Ford and Jason Kenney have talked about phasing out the vaccine passports, but they haven't given any clear targets. These are also the people who said they never bring in vaccine passports and have. And Scott Moe, who used to be a conservative, he's very happy with his vaccine passports from the press conference I watched. And the media is giving a lot of trouble because he's a conservative. So it's a thing, right? So Donald Trump is at fault for all the COVID cases in America. Ron DeSantis is at fault for all the COVID cases in Florida. However, Bill de Blasio is not at fault for any of the COVID cases in New York, and Andrew Cuomo is not at fault for any of the cases in New York State. Right? So it's what's beside your name? Is it a Republican or a conservative? Then you are 100% at fault for 100% of the COVID cases in the areas you govern. Democrat or liberal, then it is not your fault. Then it's other factors we will look for. So that's another.
Well, the only reason that people even think that these lockdown measures and the restrictions work is that every single time the government sort of identifies that maybe it should do something, and I don't even think they should do something, but whenever they think that they should do something, we're already on the downward slope of the spike, or we're like nearing the climax of it, and then it starts going down and they say, well, that must have been whatever we did to stop it. And I think whenever people sort of assume malicious intent on politicians when it comes to the measures, I don't think it's not that the politicians want to like ruin your life or something. Politicians love taking credit for stuff, so they love putting in useless measures while the situation is taking care of itself, so that they can sort of they can like be in front of the parade for solving the problem, even though literally nothing happened.
Yeah,
I just
that's
hate
another.
that. Whenever people are
That's
like, oh well, like because go to any of these people who are whining about like, oh, we need to flatten the curve, blah 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 blah. Like we need all these extra lockdowns. We've had 4 waves: the first wave and the second wave, and basically the third and fourth wave, or less. The fourth wave is in Alberta. We haven't really had lockdowns as much as passports and other restrictions. But in the first 3 waves, how well did it really work out for us to have lockdowns? It didn't help at all. But everyone's pretending as if we tried a 4th time, it'll finally work.
Yeah, that's another thing. But yeah, it's the politicians feel pressure to do something, and lockdowns are just a thing. Even though, as we'll say again, the number one scientific basis for the lockdown, scientific air quote, was asymptomatic spread, which turns out not a thing, right? So the other, I mean, the other thing is like people aren't stupid. People aren't that stupid, as we could say, is like so many times they've said things like, oh, the government, yeah, like it turns out, science, TM, trademark science, it always just happens to coincide with the government. So the Canadian government was screwing up and couldn't get enough vaccines, so people had to start mixing vaccines because we couldn't get enough Pfizer or AstraZeneca or whatever or Moderna at the time. So it was just you take whatever's there, just take whatever's there. I'm sure it's fine. It's fine. And then magically, luckily, the science came out a few weeks later and said, you know what the government just did? Turns out it's scientifically accurate, right? And then all the rush to get the vaccines. Well, now, like they said on the CBC today, well, it turns out the longer you waited in between getting your first and second dose of the COVID vaccine, the more effective and long-term your immunity is. Well, looks like we didn't know what the hell we were talking about a year ago. Right. So again, this is the dishonesty, right? If the government and the health officials are just sort of honest and saying, hey guys, this is new and we're feeling our way through it with you, right? And but this is a great, like, as I said, COVID is not more dangerous than giving up your own personal political ideology. And that's for everyone across the aisle. What I mean by this is Justin Trudeau probably knows the truth on COVID, and I'm not saying it's fake, but COVID is not bad enough that if Trudeau was presented with the option of saying, okay, to cure COVID, if he was told by Dr. Theresa Tam tomorrow, you will cure COVID if you go on TV tomorrow and say there's only 2 genders. He won't do it, right? Because COVID is not more dangerous than giving up his personal ideology. And that goes for everyone across the board, right? And this is sort of the thing where like everyone's been using COVID as an excuse to do what they want. So like there was no scientific consensus, but people, the government and the tech companies, they want to shut down free speech and they want to get shows like this off the air. So it made sense to say, oh, spreading misinformation of COVID is what's causing the pandemic. It's bad. We want to take Trump off Twitter and say words are violence. So because that was their personal political ideology beforehand, see Bill C-10, C-36, right? This then became a mechanism to do that. And I think people are smart enough to realize, like, how many times have they changed the goalposts on you? How many times have they told you something was scientific consensus a year ago that now is something else, right? And it's Orwellian because you might have had a small YouTube channel, you might have said something that the science says is correct in October 2021. But in October 2020, you lost your YouTube or Twitter account for saying the exact same thing, and you lost it for spreading misinformation.
You even brought it up, I think, on your own show at one point. Just like the levels of trust that people have for the legacy media and online media are completely disproportionate to where the legacy media thinks the problem is located.
This was my favorite science.
Also, going back to the mixing of vaccines, they've actually flip-flopped on that like 3 or 4 times because I accidentally got Moderna the first time I got a vaccine. Then the second one I got was Pfizer. And right after that, despite the fact that they were telling you to get doubles of both, and they're like, no, actually getting a mixed one's better than not getting a mixed one. And then later on, the Biden administration said, like, you're actually not allowed to come to the United States to cross the border if you have mixed vaccines, even though Canada was saying it's better, and Canada had no problem with it, although Canada had its own stupid issues with you need like 17 tests before you're allowed to come into Canada from the US. But then the Canadian government had to put pressure on the American government to say, hey, no, mixed vaccines work. And now the American government is having to put pressure on Justin Trudeau to say, hey, maybe people don't need several tests to cross a land border. like, and the funny thing is, all these people who a lot of people in the comments would call globalists are so isolationist intellectually throughout the pandemic. There's so many countries doing it better than Canada and doing it better than the United States, but you're not allowed to talk about them because we'll take the socialist economics from abroad, but if you take their COVID policy, you're somehow a nut.
Yeah, and that's the thing. Is like, do you remember 5 years ago when if any Scandinavian country did something, Bernie Sanders would tell you we have to do it because Sweden did it? Some of you might not. I think everyone's old enough to remember 5 years ago. But 5 years ago, if Sweden, like, oh, we throw babies into a volcano, you'd eventually hear from Bernie say, it's Sweden. They take the babies and they put them in the volcano, and we need to do this here in America, right?
That's a
Because
good
Sweden
thing.
does it, right? And then someone would go change his diaper, and and then he'd get back onto. In Sweden, they do this. In Sweden, they have an IKEA. An IKEA is a place where you take the furniture and then you build it yourself. And we need to do this here in America. And then someone would be like, Bernie, there is an IKEA here in America. Actually, one of your 3 homes is furnished with IKEA furniture. Oh, okay, right. So there's that. But now, because Sweden had a heterodox take on COVID. And you look at the numbers in Sweden and Scandinavia, like they didn't do that much better or worse than all the lockdown countries. They never did lockdowns. They never did mask mandates. Like every time numbers went up in Sweden, the media would be like, "See, look, it's terrible," but the numbers would be going up everywhere, and then they go down with everyone else. Like it was sort of a seasonal thing, and it's like we kind of need to.
It turns out if you cover something with more focus, it looks worse than if you don't cover something at all. It's like whenever they cover Florida, when there's a slight uptick, they're like daily counts. They're doing like hour by hour how many people are being diagnosed with COVID-19. But Louisiana, right next door, is in a worse situation. But it doesn't seem as bad. Even to me, I don't even think Louisiana is that bad. In a certain like social way, it doesn't seem like a big crisis because I never hear about it. I know it's worse than Florida, but Florida seems like it's always like in this weird crisis mode because people tell me it is.
Right. And the reason Florida's always in crisis COVID mode is because the media sees Ron DeSantis as a legitimate Republican contender for president. So they have to make him seem like the devil to most people. I mean, do you remember that one commercial that like the Democrats or some insane like
yeah it was like it was
Florida,
the
where they believe in
like
freedom and they don't want to force the government won't force you to take a vaccine, and
like it was fantastic parody, and everyone was pointing out. I think even Ron DeSantis, I think it was like get rid of Ron or something, like was the PAC's name or whatever, and even Ron shared it and said it made him sound awesome, and they're like, no it doesn't, you're just coping, and then they quietly removed the ad and never played it again because it was just like, oh my goodness, this man Ron DeSantis thinks you should be able to say what you think. What a disgusting heathen.
Let's get him. Yeah, that was great. So that's another problem. It shows us we live in 2 different worlds, and like, so I'm totally on the I'm on the like let's go Scandinavia there. If people watch my show, they know like we've talked about like we both got our vaccines. I'm not getting any boosters. I'm also decided I'm not getting a flu shot this year. Like listen, the flu shot isn't that big a deal, but it's like I think it's like I'm now at the point where like it has to kind of be said to the medical community, like I don't trust you. You haven't stood up to the tyrants, and like it's not that I don't trust the doctors. It's I don't trust the doctor's ability to not trust the establishment, and that's it. Like I think the people feeding the numbers to the doctors are corrupt, and I think the doctors just can't fathom it because they're not trained to think that way. But I think the people feeding the numbers, the doctors, like I think the doctors are doing the best job they can with the information they're being provided. I just think they're being provided deeply flawed information and don't have the skills to like doctors aren't trained how to determine. Doctors are trained how to determine information from the data they're given. They're not trained to analyze the process and how the sausage is made. Right? They're like,
the problem for doctors is they're also not in an incredible, when I say this, I know they meet with patients and whatnot, but they're not in an incredibly social field of like practice. It's not like they need to be able to communicate well with people. Doesn't mean that doctors aren't good at communicating, but in the sense that
it takes my mom like 74, like it takes my mom 72 hours to tell a story of what just happened. So my mom is not an effective.
But it's a STEM field. In STEM, not to be rude because I'm also bad at communication if it's not online.
Sure.
Like you're not going to have a lot of doctors who are in sort of like the social environment in which they think this is wrong. I'm going to go tell everyone about it. In the sense that in like a STEM field, especially, I feel like there's a little bit of a feeling of unless I can prove every single little bit of what I'm saying, I'm not going to stand up and say that what the other person said was wrong even though it's clearly wrong. I can't absolutely prove it, so I'm just going to say nothing. Also, it doesn't help that you get a lot of doctors like trying to disprove COVID or something like that, that it's not real. It's like, and now no doctor wants to stand up and say anything because you're going to get labeled a nut like those other people, even if you're fully rational and you can prove what you're trying to show. That's what frustrates me to no end with all this. Is you get all these people sort of coming out of the woodwork saying, hey guys, I know what the real truth is. Truth is such a stupid buzzword these days. I honestly hate the word, but people are like, I know what the real truth is. And then it's like a bunch of sovereign citizen crap, or it's like someone misreading a medical study. And it's like, good job, dude. Now everyone's going, now you're making more people more reliant on the government because they think that you're full of it.
Yeah, I mean, yeah, it's not. I mean, so yeah, the way forward. Like, let's have a heterodox COVID take here. You know, as I was saying, like with the kids and the vaccines having low efficacy or diminishing long term. Like, here's where we kind of need to like have some hard talk and like a functioning society would say, okay, you know what? The kids seem to survive COVID extraordinarily well. Okay, the risk for, as you said, shark attacks are more likely to kill your kids under 12 than COVID. So we need to make shark repellent bat spray mandatory. Or say, we need schools to be open. We need to open the schools. Like, this is counterintuitive. If the kids are near immune, get them in the schools. You should prioritize vaccines to the teachers if they want to take vaccines. I mean, I'm a voluntary vaccine guy myself. Um, I would say, had I known, like I probably should have known, but like had future Daniel come back in time and said they're going to put in vaccine mandates and vaccine passports, I wouldn't have gotten the vaccine. Like I'm that obstinate. But let the teachers get vaccines if they want boosters because they're that paranoid. Let them. Okay. The schools need to be open. The kids need to be with each other. If your kid gets sniffles, stay home. But it's best if because the child population is safe. Like if the virus can burn through the kids, right? Give them longer lasting immunity. That might be the safest thing long term for the kids to have natural immunity because it doesn't seem to be killing them. And the vaccine tends to might have some long term risks on a societal level. And when I say these long term risks, I don't mean like long term blood clot, heart attack, and that might manifest in itself. Like that's another. I'm not discounting that, but I'm saying the long term risk, and which is why I think it's good to have a significant. I think it's good to have an unvaccinated segment of the population as at least a control group. But the long term risks are okay. What if getting a RMNR vaccine spike protein severely inhibits your ability to form natural immunity 2 years from now? Like, what if we have a real hard time like building up immunity? Like, what if the vaccine? Like, okay, here's a huge risk of these vaccines that no one is even willing to engage with, because it's not like it kills you, and it's not, and the vaccine people don't want to talk about this, but what if the vaccine has waning efficacy, right? So it wanes at about 6 months now. You get 2 shots, and that gives you about 6 months. Okay. What if you get your booster shot and that gives you 5 months? What if you get the next booster shot and we see, okay, the next is like 4 months? What if they have a half-life, right? What if there's an efficacy half-life? And then on top of that, what if, right, they prevent you from building up natural immunity? So what if you get COVID and then the more vaccines you have, the worse natural immunity you tend to get? So now we have an entire population that just can't build natural immunity to this, and we eventually get to a point where the half-life of the vaccine have become so ineffective that we have no ability to fight COVID whatsoever. Like, and then long term, the unvaccinated part of the population is much more resilient to COVID than the vaccinated part. Like, what if that becomes the case in 5 years? Right? That's something we're just not willing to engage with because, again, we have no long-term data on these things, and this sort of push to force vaccine to 100% of the people is insane.
It's just like using more and more insecticide. Eventually, you're going to have to bite the bullet and just realize that you're going to lose some of your crop. And by spraying more and more and more, you're actually just sort of you're just more so holding back a tidal wave that will eventually have to break through and do more damage than it would have if you just said, there's a certain amount I'm going to spray and I'm not going to do any more because I know I'm basically just making insects more resistant over time to what I'm spraying. I should just do a little bit, clear up, sort of mitigate the damage, but I'm going to let the whatever come because I can't stop everything. Also, yeah, you should read that quote from John Barlow that Karen got back in an email.
Yeah, I will not support mandatory vaccines. In fact, every medical expert and official who has testified at a health committee, of which I'm a member, did not support mandatory vaccines. Right? Yeah, I know of doctors. So the thing in Ontario is like, like a doctor in Ontario cannot give their opinion on COVID unless it is the government line. Like, if you go to your doctor and they're not in favor of vaccinating a 7-year-old, they can't tell you that, or they will lose their job. Like, they have to say, like, I know of doctors who like literally have to read off the script.
It's like we have conversion therapy laws for COVID.
Yeah, essentially. That's essentially what it is. And yeah, like maybe the majority of doctors do say it's safe, and maybe they're better at looking at the studies than I am, and they they believe Dr. Theresa Tam, and they just don't know about the part where she was basically signed an agreement with the World Health Organization, which is controlled by China, to to keep COVID numbers and key information about COVID a secret from the Canadian public, and then been in charge of the Canadian health response. And maybe that's just totally fine with them. But yeah, like I know of doctors who will, like, when they recommend the vaccine for your kids, what they will do is they will just they will just look down at the thing and read what the Ontario government wants them to say at you in a monotone voice, and then give you a look, and like that's what you're supposed to infer from that. So if that happens to you, that's what the doctor's trying to say, is like, I'm not allowed to tell you anything but this. So that's and like what we should say also in the CPSO, like the College of Ontario Practitioners, like, you cannot dissent. So it's like this body, and like it's way out of control. Like the college is way out of control in Ontario. You cannot go against like standard medical practices in any field, which is insane, absolutely insane. Like the medical procedures.
You said you. Oh, I was going to say, you said you met someone from the CPSO the other day who basically confirmed that like a lot of our reporting on AHS would be true about a lot of the health services around Canada and how incompetent they are.
No, I didn't. I'm not gonna tell the story because the person wants it.
Oh, never mind. Fair enough.
That's not exactly what happened. So I'll keep that on the DL. No, I met a doctor who read your story in the AHS stuff. He's not from Alberta, but so yeah, there's you were the one who said you met someone from the AHS who was like joking about forewarning patients, or I guess it was called Ontario, sending people to psych ward if they disagree.
No, that wasn't. Yeah, that was in Alberta. That was in Alberta. I had someone just like, they were like a doctor/nurse. I forget what position they had in Alberta, in an Alberta hospital, but they were just joking that if someone is like doesn't want a vaccine or something like that, that they can essentially harass them in certain ways, have them move to different areas of the hospital, have them sort of put into an isolation center. When I say isolation, not in like the COVID isolation, but in terms of like essentially being locked in a room by themselves, sort of a thing, and just like nonsense like that. They sort of take joy in the fact that they're going after people that they politically disagree with in the hospitals, which I think is slightly horrifying, because the guy just took, like, the guy was pure joy in his voice as he was just saying, oh yeah, no, it's hilarious seeing these people freak out about it, and says, oh, I can just do this if you keep like fighting me on this.
Yeah, it's kind of, it's ridiculous. And like there's the other problem of like we're at such a bad point in society. Like at the beginning of the pandemic, YouTube would suppress videos if they mentioned COVID by name in the title, or even said COVID during the thing. Like I'm sure this video is getting suppressed because it's in the friggin' scroll there, and I've said it 8,000 times, and we're all putting in the thing. But like I believe you just by making better content, like people will like that better than if like we're not gonna say the word, like, okay, that's silly. But
Facebook, one whistleblower to Project Veritas came out and confirmed that there is such thing as like a vaccine hesitancy scale on Facebook, where simply talking about COVID or talking about vaccines, even if your information is not wrong, if you're not from a particularly like trusted source, you're your content in the background will get flagged as vaccine hesitant, and it will like reduce your distribution on that story by like down to like a third or even a fifth. I've had stories where should have been a very, very well read story in the sense that not like everyone should read what I write, but it was like actually kind of some explosive information that we had exclusive access to at the moment. And you would get like 30 likes on the thing and you get like 2 shares. And it's because no one's seeing it. And you look at your reach after, and despite the fact that the story's been out for 24 hours, only like 240 people were able to even scroll past it on Facebook. It's been one of the most frustrating things over the past like year and 8 months at this point, is just knowing that I'm going to put 3 hours, 5 hours, 2 days of effort into writing something, and then you put it up on Facebook and they're like, nah, only CBC is allowed to talk about that issue. You might even agree with someone from CBC on the issue and you're just adding some extra commentary, and they're like, no, you're not part of the list, as if we're trying to get into a stupid nightclub.
Yeah, that's the thing. And like, but what I was saying is like, and it was so ridiculous. Like, you'd watch YouTube videos and people like, yeah, I can't mention the disease, and like, if they were talking about like things like football or like books that I like, right? It's someone to mention like, probably someone's making a book about like, yeah, sorry guys, I'm just here because the COVID lockdowns. Like, you can't say that, right? And it's so asinine that we live in a society where everyone was like, where they had the idea of like, let's suppress conversation about COVID to make everyone safer. Like, in what, like, wouldn't you want people having conversations like in free spaces about what to do for COVID? Like, yeah, some people would say some batshit insane things, but some people would say some pretty thoughtful things, and maybe they would gain traction, and then the higher ups would have to engage with this. Like, this new ideas, like heterodox ideas, are probably what could drive our pandemic response, better. But like, you know,
The thing is
that
too,
was
it makes it so actual misinformation is the stuff that gets shared the most that Facebook tries to suppress. So if it's suppressing everything down to only a quarter of what the usual engagement would be, well, the actual rational information on COVID-19 that might be sort of a counter the legacy media's narrative, that stuff won't get shared, but the super explosive actual misinformation will get out there because their stuff is inherently more compelling to the average person than someone just sort of talking about ICU bed numbers and what AHS had promised and whatnot. The crazy crap is what actually gets promoted when Facebook just blindly censors everyone for even using the word COVID in their articles. And the funny thing is that the legacy media can talk all they want about it, despite the fact that literally they are the least trusted forms of media on the planet at this point.
Yeah, it's another thing. It's like, K girl like point out, like, yeah, there's been no studies done on the boost. So of course there's such little information on this. And like, this has been the frustrating thing. It's like, had they just been honest and like been like, okay, here's why the things are the way they are, I think we'd be in a lot better state. Like, as I was saying from the beginning, like, I understand why there's no manufacturer liability on these particular vaccines. It makes sense. In the outset of a pandemic, they were in such high demand, everyone needed them. We were in these lockdowns, and because they're new and because they're sparsely tested, we don't really know that much. So Pfizer, if I was the Pfizer CEO, I would never give these vaccines to market if I had some manufacturer's liability, because it'd say like, hey, you rushed me. Like, if you say I need a building built in 2 days, right? Okay, I'll build you that house in 2 days, but you're going to pay me overtime, and I'm not going to be liable on the insurance. Like, you're going to have to give me some non-liability, and that makes sense, right? That makes sense. But on the other thing, right, then you can't mandate this, right? So you understand how it got that way, because they didn't have the amount of time. And if the government was just honest and said, listen, okay, the reason why this is because these are rushed. We have as much data as we can. We think it's effective here. So anyone who wants to take it can take it, right? And if it was totally optional, then people would get it. But if you're going to rush the vaccine, if you're going to grant them the fact that they don't have to have manufacturer liability on it, well, then you can't mandate it. But now we're having our cake and eating it too. Now we're pushing the mandates. So now it becomes a point where they are lying about it. So like if the vaccines were purely voluntary, you can understand, okay, these are the risks you're taking. Here are the short-term data. Here's your risk reward. But, there's no long-term data on these things, and there's no manufacturer liability, right? These are two major reasons why you cannot mandate that. Now they're being mandated anyway because screw civil liberties. But again, like there was an explanation there, but that explanation required a mature government and a mature government to understand that there's a mature population. And I say this all the time, like people, if you treat them with respect and if you treat people with the expectation that they're going to react reasonably and rationally, you will get a population that reacts reasonably and rationally to a lot of things. When you treat people like children and that they will be unrational and then you lie to them, well, people can act rather irrationally to you, right? This is kind of so. This is the problem: is they were totally lying on this, right? They did not respect the population. Weren't honest and say like, okay, here's the deal, like this is why it makes sense. Like these vaccines, it's great that we got them so quickly. This mRNA technology can be pretty great. It could have great, health benefits to transfer to other things. Like I hear there's an mRNA malaria vaccine now. Like this could be great. But because we're not treating people with respect, openness, and transparency and expect them to make reasonable and rational decisions based on the information provided to them, and we're hiding information from them, and then we're gaslighting them when they actually find, like, when people find this rather big thing that, hey, there's no manufacturing liability on this, and you're forcing me to take it, what the hell? Now we're gaslighting these people, right? Which is the absolute wrong response on all these things.
And I think socially, it's just been extremely destructive for for the government to ever say, we actually don't need to justify this fully to you. We're not going to give you full information because we think that somehow you can't handle it. If they just came out right away and did a cost benefit analysis for people taking the vaccine, like here's the small risk you have of taking a vaccine, here is the much larger benefit you get from taking it, you'd have much more people say, okay, that's fine, you're being upfront, you're being fair to me. But even though I would even still say, like, yeah, like the benefit to getting the vaccine for people over a certain age is much better than the risk is for like of taking the vaccine. Like, of course, people would understand that, but because they just think that you can't handle doing the cost benefit in your head, even as is explained to you with the numbers, that's what's sort of been sort of socially not kind of, I was going to say cohesive, but that's not the one. Corrosive is the word I'm looking for. It's sort of socially like corrosive when we're sort of just acting like the average person can't handle basic information.
Yeah, and yeah, this is I'm saying, like, treat people with respect, present them the truth, and like one of the best things you can do, like to be, people think, and like there are crazy people out there. There are crazy people who maybe listen to part of this episode, and because we didn't take their particular line on COVID, they're unfollowing National Telegraph is now fake news. Because Daniel and Wyatt got 2 vaccines, they can't be trusted, and all this. But reasonable people, even if they disagree, are more likely, I think, to trust us when we say, hey, we don't know this, right? Like, I'm not your go-to source for Bitcoin information. Okay, I kind of understand what cryptocurrency is, but don't ask me for cryptocurrency investing advice. Like, that's not my area of expertise. And I think a lot of people would feel more confident when the government says, like, hey, here are the things we know and think are pretty solid. Here's why. Here are some unknowns, right? And we think this is the best way forward. We think the risk of COVID is higher than the risk of the vaccine. So, we're going to roll up our sleeves. We'll get the vaccine. We hope you do too. And more people are more like, okay, that. But again, we were pushing instead, there's no risk to the vaccine. The vaccines are great. They're 100% effective. And it's like, okay, we're talking about 90% effective, 6 months waning, with risk of myocarditis in young men. Like, okay, here are the risks, right? But all the risks are completely like swept under the rug. And I say, like, when you present the vaccine as zero risk and then billions of people get the vaccine, well, it's a medical treatment, which means some people are going to have adverse side effects just by the numbers. And, I don't trust any of the numbers anyway, so it's impossible to know. But, the numbers, hypothetically, even if you hear all these stories, like the numbers on aggregate could actually be pretty good for the amount of side effects happening from these vaccines. Like they could be good on aggregate. However, they seem much worse because the government promised you a fairy tale. It promised you a unicorn. It promised you that there'd be no downside to this. And then, even though there's maybe small downside, because it is much bigger than what you were promised, right? It seems much bigger, and it makes the thing scarier. And then more likely people are to there. So,
Well, the funny, yeah, like, and that's why we also inserted fantasy into the title of this episode. It's like every single move that the government's been making is completely contradictory, and it only works if you sort of buy into the government's fantasy narrative, in the sense that, like, no, we can better fund we can grow the medical system, we can pay doctors more, we can pay nurses more, we can grow the amount of ICU beds. Also, everyone can stay home and just be on welfare. Also, guys, everyone needs a third booster shot. It's far more healthy. Also, don't criticize the efficacy of vaccines. They work incredibly well, and it should protect you for life. Also, throw on a mask, or the unvaccinated people are gonna risk the lives of the vaccinated people. Everything is just only works if you're sort of in the fantasy lore that the government is pushing. I don't think it's deliberate. I don't think they're sitting around a room figuring out how do we manipulate people into doing what we want. It's incompetent bureaucrats who are not experts in the fields that they talk about, trying to square their political priorities with COVID policy. They're trying to make their polling numbers fall in line with their COVID talking points. They need that. They need their polling numbers to rise 5%. So they're sort of saying just the right things week to week that they think is going to help those numbers. And of course, that's never going to, you're going to contradict themselves all over the place, because find an issue where politicians don't contradict themselves multiple times just trying to be popular.
I think that's like a perfect way to say it, because I think you just perfectly summed up the pandemic response. Like, I don't think we'll top that on, like, that was a good rant.
That's the first time I've ever done something right.
That's the first time we've ever, guys, please like and share the video, because this is the first time Wyatt's ever done anything right. I will be calling his mother. We will be throwing a party. There will be sprinkles on the cake.
I think I am going to try and take the high school diploma this year.
Yeah, you can do it, buddy. You can do it. Wyatt, we will be reading a book to Wyatt. I'll be reading a book to both my nephew, who is a toddler, and Wyatt. Don't worry, there's lots of pictures, Wyatt. So it will be one of those books.
I like how I do something right, and I immediately had to pay. I like how I did something right, and I immediately had to start denigrating myself. I'm not insecure.
All right.
Hey, wait.
Okay.
I just want to say, because we're coming to the end of the episode, and I want to ask you this at the start, because you're in comedy, you're in the comedic field, and you're also in psychology, so you at least know a little bit about crazy people.
I'm not in psychology. I took a psychology degree back in the day, but yeah.
You have a psychology degree. That's good enough. But because we never talked about this, despite it being 2 or 3 weeks ago, I want to make this fast. Because you're in comedy, you've probably talked about people's sets with them, people pitching jokes and whatnot. Has anyone ever pitched you a worse joke or a worse bit than that Stephen Colbert vaccine dance?
No, never.
No? Okay.
No, never.
I'm just checking.
Never. Not possible. And and I do some unfunny comics in Toronto that you just kind of have to sit and bear, but no, never. Not once.
Okay.
Not even close.
Okay, that makes me a little bit more confident going to a comedy show in Toronto. Oh, but everyone, make sure you remember that we do have a GoFundMe going for our legal fundraiser against Aaron O'Toole's people suing the National Telegraph and Daniel. So hopefully you'll be able to help us with that. Raise the roof a little bit in the GoFundMe while you're waiting for next week's episode to come by and Daniel's show tomorrow night.
All right. So thank you very much. I will say goodbye from the subarctic, where things are actually pretty nice up here. And Wyatt is in Alberta, a formerly free province. And thanks everyone for being here. Thank you for liking, sharing, and click all the buttons, like, subscribe, share, blah, 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 blah. You know what to do. Thanks so much. I will see you all tomorrow.